Bismillahirrahmanirrahim. Right, ladies and gentlemen, we'll talk about chronic bronchitis now. Please remember that chronic bronchitis is primarily a clinical diagnosis and not an histological one. So you should at least know the definition of chronic bronchitis, the clinical definition of this disease. That it is the presence of a productive cough. Remember that the word is productive. You can get this thing in scenarios that this is productive cough that happens at least 3 consecutive months, for at least 3 consecutive months and at least 2 consecutive years. Okay, so this is the clinical definition of chronic bronchitis. The main gross morphological feature of chronic bronchitis is that it affects the larger airways, which and its mucosal lining, and then there are changes on the surface, and then there are changes in the deeper areas. Now on gross morphology, the lining may be hyperemic, that is the mucosal lining of the airways. They may be hyperemic, may be red appearing and swollen due to the presence of edema fluid, and then there may be mucus secretions on the surface. Now this is how this might look like on morphology. This is the area that shows the increased mucus glands. Okay, you can see these are markedly increased in comparison to the normal. If you look closely, if you go back and revise your normal morphology, these are greatly increased in numbers. This is increased in thickness, and the surface lining, which usually is columnar, shows squamous metaplasia. Okay, so these are the two main morphological features. Then there's a word known as reed index that may be used sometimes in scenarios. So do read that up from your books. Uh, Pertinent points. These points to be written on your notebooks as well. We saw in the previous photomicrograph enlargement of the mucus secreting glands. There may be variable numbers of inflammatory cells, mostly lymphocytes, as it's a chronic process, but acute insults may lead to accumulation of neutrophils as well. Okay, and as we saw in gross, as we noticed in the gross, there may be mucus on the surface, so mucus plugging may be seen, and then as again it's a chronic process, areas of fibrosis may also be noted. So these are the main morphological features, these are the details. This is it for now. Please let me know if you have any question.